Welcome to Community Health Briefs, where AI hosts share short, clear stories about research shaping healthier futures. Each episode highlights new work from members of the College for Community Health at Montclair State University, showing how ideas connect to the social and structural forces behind health. In short, this is research you can trust, explained by AI in minutes.
You usually picture a safety net as this incredibly strong, reliable weave, right? Like it effortlessly catches anyone who falls.
Yeah, that's the ideal.
But what if the people holding that net together are getting their hands cut to shreds by the very threads they're grasping? Today, we're looking at a 2026 pilot study led by Dr. Melody Benedict and her research team.
Right. She's over in College for Community Health.
She's a critical scholar activist focusing on racial trauma, and her team, including Drs. Nelia Quezada-Horn, Channel Lattery, Destiny Bender, Heather Larkin, and Sarah Mounts, they took a really hard look at 4 Black clinical social workers in New York.
And, the mission here is to understand the actual lived reality for these clinicians, because if we want a healthy community, we really can't ignore the hidden damage being absorbed by the people actually providing the care.
Right. And to get to that reality, the team used a method that, it completely caught me off guard. They took raw interview transcripts from these social workers and used blackout poetry.
Which is such a fascinating approach.
It really is. Literally taking a black marker and crossing out words until only the raw emotional core of the text remains. I love the idea of finding the signal in the noise of a chaotic clinic, but I do have to push you on this a bit.
Sure.
Is taking a black marker to your data actually rigorous? Like, doesn't erasing words make the findings completely subjective?
Well, it sounds counterintuitive for a scientific study. I totally get that.
Yeah.
But think about standard data tables. They often sanitize human emotion into these neat little categories.
Oh, yeah. Stripping all the feeling out.
Exactly. Blackout poetry prevents that. It forces you to look at the visceral truth of the experience. The researchers rooted this in Black feminist thought, which means they aren't just looking for, generic workplace stress.
Right.
They are specifically trying to capture how the overlapping realities of being Black and often female shape every single interaction in that clinic.
So what actually remains on the page when you strip away all that administrative jargon?
Some truly heavy realities. You see profound, overt racism coming directly from the people they are trying to help.
Wow.
Yeah. There's a crisis social worker they interviewed named Ashley who had a client repeatedly sing racial slurs at her.
Just singing them. That's awful.
Yeah. And a hospital social worker, Paul, who was repeatedly called the N-word by a smirking patient. And Paul just had to, freeze, absorb it, and keep working.
And the most striking part of Ashley's story, for me at least, is that her colleagues were right there.
Yep. Right, in the room.
Completely spared from the tirade, and nobody stepped in to relieve her.
Not a single person. And that exhaustion doesn't just come from those direct attacks either. It's the ambient pain of the environment. Imagine watching the system you work for actively harm the people you're trying to save.
The vicarious trauma.
Exactly. Ashley talked about a 15-year-old Black client who was grieving. He was knocking things over, but not actually hurting anyone.
Right, just a kid in pain.
But the staff called a code and aggressively restrained him. Standing there, witnessing a child from your own community treated with excessive force, that creates a massive secondary trauma.
So you have the trauma from the clients and the trauma of watching the system fail people. But the study shows the harm also comes directly from inside the house, right? Like the workplace itself.
Oh, absolutely. James, a hospital social worker, had a white colleague casually refer to his hair as a Brillo pad.
Wow. Just casually.
Yeah. And Kayla was on a virtual staff meeting where a colleague actually used the N-word while quoting a client.
Which is just wild for a professional setting.
And it gets worse because another colleague later brushed it off. They said it was okay because the word was technically, quote unquote, in quotation marks.
When you layer all of this together, the clients, the systemic violence, the colleagues, it goes way beyond a bad day at work. This is chronic.
It is. It becomes a structural determinant of their everyday health. Constant exposure to this hostility leads to racial battle fatigue.
Right. It's a physical toll.
Yes. Their bodies are reacting to an unsafe environment. And the study emphasizes that we cannot keep telling Black workers to just build better individual resilience. The organizations need a systemic redesign built around collective care.
Only challenge that, though. Collective care sounds great in a research paper, but in an underfunded, chaotic hospital, how do you actually implement that without it just becoming Like another unpaid diversity committee for Black workers to sit on.
Well, that's the crucial distinction here. True collective care isn't a committee or a pizza party.
Thank goodness.
Right. It means redesigning the workflow so the burden of protection is shared institutionally. If a client is hurling slurs, there is a mandatory protocol for a manager to step in and relieve that worker immediately.
Rather than leaving them stranded.
Exactly. It's about building structural boundaries that protect the staff, rather than expecting the staff to just, absorb the abuse.
It shifts the responsibility from the individual back to the institution.
Yeah.
Which is huge. The big takeaway for you listening is that the social work profession simply cannot achieve its core mission of healing if it allows systemic racism to quietly break its own practitioners.
Which leaves you with something critical to think about. If the very professionals trained to guide us through our health crises are silently absorbing and surviving this much unaddressed trauma, how might that invisible burden be shaping the quality of care everyone receives?
It changes the entire picture. Next time you picture that safety net catching us all, it's worth asking who is bleeding to hold it up.
Thanks for listening to Community Health Briefs. This podcast was created with the help of AI, verified by the paper's author, and does not necessarily reflect the views of the College for Community Health or Montclair State University. Thanks again for listening, and stay tuned for our next episode. Make sure to subscribe and check us out at www.montclair.edu/CCHL to learn more about us and the amazing work we're doing for community health.